Hello everyone. We will look into the very main features of delirium along with their management and etiology. When coming to the core features of delirium, that will start with the altered consciousness, where the person who is suffering from delirium will have a very decreased level of consciousness in them, and it will always accompanied by the fluctuating attention as well as awareness in an individual, where the person will have lot of struggle to stay awake and to remain attentive in their surroundings. That's the first core features. And then attention impairment, where they'll exhibit lot of problems with their focusing, sustaining and different types of attention, and the problem with their cognitive impairment, as it is written in the ICD criteria. Cognitive impairment, global disturbance will be seen here, where lack of orientations and lack of difficulties with respect to memory, attention, many other things. And then rapid onset and fluctuating course. So typically delirium develops rapidly, that is over hours or for the days, and its severity can fluctuate dramatically throughout the day. That is, where the symptoms might start now very normally, whereas it might worsen at the night. So that is why it is called to be very rapid onset and fluctuating course. Now coming to the main aspect, that is etiology or causes of delirium. Delirium can be caused mainly by several reasons such as infections. So infections, particularly UTI, pneumonia, sepsis, these are all some of the causes of delirium, which starts with these particular diseases or infections, which might last later towards the cognitive impairment. And body's response towards the infection, including inflammation and fever, can disrupt the brain functions, which might lead to development of delirium. And the second thing, it might be because of electrolyte imbalances, that is the neurotransmitters which is present in our body, and along with that there are also the other electrolytes which are present in the body, for example sodium, potassium. So high level of sodium or high level of potassium, low level of sodium. So all these are also the imbalances might be one of the cause in the development of delirium. And then dehydration, hypoglycemia, where low blood sugar, these can also be one of the cause for the development of delirium. And other causes includes malnutrition, diarrhea or kidney disease. Then medication is one of the other important risk factor being noted according to the studies. So certain medication, especially with the anticholinergics, opiates or benzodiazepides, sedatives, these are all some of the medications which might lead to the development of delirium, and hence it's proved that most of the people who are admitted to the hospital with certain physical conditions are more likely to develop delirium, because as a side effect of their medications. And one of the very active neurotransmitter that plays a role in delirium is acetylcholine. And then there are also some of the withdrawal syndromes, like withdrawal from the alcohol or any other medications can also develop the delirium. For example, if an alcoholic for a certain period of time, if he is not consuming alcohol, so that he could exhibit withdrawal symptoms. So later when the withdrawal proceeds later to the extreme level, that might cause into the development of delirium. So this might be the another chances. And withdrawal can also include anxiety, tremors, hallucinations and seizures. So delirium can also be caused by some other factors, that is called as head trauma, severe dehydration and underlying conditions like heart failure, stroke, kidney failure. This can also be the cause for the delirium. Now coming to the neurological basis for the delirium, acetylcholine, as I stated in the previous slide, acetylcholine is one of the important neurotransmitter which will lead to the development of the condition called delirium. Especially acetylcholine is a neurotransmitter that is very important for the attention and arousal functioning, and in case if there is a decrease in that transmitter, that might also cause towards the impairment of cognitive functions in the delirium. And one more part of the brain that helps to or that leads or plays the major role in the delirium is reticular formation, which is present in the brainstem, and that is a critical area again for the regulating of attention and arousal. Again, if there is any problem or damage with the reticular formation, that might also cause delirium. The other neurotransmitters along with acetylcholine such as norepinephrine, serotonin, glutamate, these are all some of the things. In case of any imbalances between them, it might lead to delirium. Coming to the differential diagnosis, how can we differentiate delirium with any other psychological conditions? The first and most important thing is schizophrenia. Schizophrenia is another mental disorder which might have or overlap the symptoms of delirium. But how can we differentiate? So, delirium symptoms are typically more fluctuating and less organized when it compared to the symptoms of schizophrenia, because in schizophrenia, if you could see all the psychotic symptoms such as hallucination, delusions, they are very much organized and you could easily witness them. But in delirium it is not like that, it is a very fluctuating course. It might be present now, but after 2 days it might be or after 2 hours or 3 hours it might be absent. So, this is how you can differentiate with the schizophrenia. Another disorder which overlaps with the symptoms of delirium is depression. So, depression, how to differentiate depression from delirium? It might be EEG might be one of the case you can take up, as it is an organic disorder. EEG helps a lot in differentiating the disorders, and other considerations could also be like in case of brief psychotic disorders, schizophreniform, all other disorders, probably we can take help from the EEG recording, which might help to significantly differentiate the brain region of a person who is suffering from organic disorder, that is like delirium, with the other psychotic disorder. Now, there are lot of symptoms that overlaps with dementia and delirium. So, in order to differentiate between them, so in dementia onset will be very slow, but in delirium it is very rapid. Duration of dementia is months to years, whereas in delirium it might last only from hours to weeks. And attention is preserved in dementia, whereas it fluctuates in delirium. And memory is impaired, especially remote memory gets impaired in dementia, but in case of delirium it will be recent and immediate memory. Speech, word finding difficulty will be present in dementia, but incoherent or slow or rapid speech in case of delirium. And sleep-wake cycle will also be disrupted more in delirium. And thoughts disorganized in delirium, whereas impoverished in the case of dementia. And awareness is unchanged in dementia, whereas it is reduced in delirium. Alertness usually normal in dementia, but hypervigilant in case of delirium. So, treatment strategy follows. The first thing is identifying, because most of the cases delirium goes unidentified. That is why the first treatment strategy is identify and address the underlying cause. Next, we have to provide very good physical support for the individuals and sensory modulation to be given and pharmacological treatment, and some of the environment modifications such as familiar surroundings, regular orientation, social support, and as much as possible we need to educate them regarding the supportive care, and that is a very important thing in delirium. We should always talk to the people, we should always be with them, and we should always provide a very cognitive and family environment to an individual. It is not that if a person is suffering, we are leaving him behind any other ashram or palliative care. Instead, we have to be with them and we have to take care. So, those are the very important management plan for the delirium. Thank you.